Good morning, everyone. My name's Carla Macias, host of San Antonio's most educational medical show, Best Docs Network, featuring one of the top medical facilities in Texas, and that is Forest Park Medical Center. We'll be bringing you the latest health topics and procedures offered by some of the best doctors in your area. Now let's start off today's show with hand specialist Dr. Jackson Ombaba.
Everything happened kind of at once with both hands. I lost control of my pinky and ring fingers, and then I couldn't hold things. I couldn't hold a coffee cup or pick up things. I was having a hard time writing, and it all progressed very quickly. I went to see 2 or 3 different doctors, not knowing what was going on, and had MRIs and CAT scans, and everything just turned up nothing.
When she came to see me, I examined her. I found out that she had what is called Cubital syndrome. Cubital syndrome is when the ulnar nerve is compressed at the elbow. The symptoms people feel when they have Cubital is the hand completely fall asleep. They've got pain in the elbow. They've got tingling in the fingers. They've got numbness in the fingers. They don't feel that they have enough strength to do their activities.
Dr. Ombaba recommended that we do surgery pretty quickly because the condition had evolved very fast, and it was worsening every day. And my life is back on track. I'm able to do anything I want. I don't have any limitations, and that's so much to be thankful for.
At Forest Park, we call it the 6 senses of Forest Park, and you have your conventional 5. And it talks about the experience that you get from the minute that you come onto our campus. So we're really kind of playing into those senses. So what are you seeing when you first get on the campus and walk into our hospitals? Are you looking at just great architecture? Are you looking at a brighter environment, with natural sunlight and things of that nature? The art program is something that plays into the healing aspect, the visual aspect. So you'll see sculpture, you'll see original pieces, you'll see prints, you'll see a little bit of everything. And the way that we attack art is you should feel a little bit uncomfortable with art, because if every piece of art in our facilities was something that you absolutely loved, then you probably didn't reach the entire community, because we all have different tastes, different aspects of what we like. What are you smelling? We have engineered scents in all of our hospitals, to where it's an engineering system called ScentStream, and it's built into our HVAC, and the scent that Forest Park has chosen is called Clean Sheets. But other things that you have just kind of coming into our environment is, what type of food are you having? The taste. We don't have cafeterias, we have dining facilities. What are you hearing when you come onto our campus and into our facility as well? Oftentimes in every facility that we do, we have water features, both outdoor water features and interior water features. So it provides a calming type sound that resonates throughout our facilities. what are the things that you're feeling? We have a lot of textural elements associated with our design. When you're coming in, the textural walls, whether it's the stone-cut exterior of a lot of our facilities, or when you're coming inside and you're feeling the texture of the fabric itself. We really try to play into all of those senses for our patients. So, whether it's in the lobby or it's in the patient rooms, or the thread count on the sheets, those are the type of textural elements that really you may not instinctively know about those, but when you actually touch it and feel it, it'll make a difference to you. Every one of our facilities is a minimum of LEED Silver. So what that means is it's our environmental impact to the community as well. So we have rooftop gardens where you have lush gardens that can be seen from all of our patient rooms. You're seeing planting, you're seeing stone, you're seeing in some cases water features associated with even our green roofs. But it's something that really kind of plays into the sixth sense of Forest Park, which is heal. And having a patient room that looks down onto grasses and trees and plants, and it intrinsically has a healing aspect that really our patients have grown to appreciate. Again, we're playing to each of those senses, and then our sixth sense is heal, because at the end of the day, that's why we're here. We're here for the community, we're healing patients, and providing a place for our physicians to practice medicine. Walking onto our campuses from step one, what we really kind of focus on is that entire experience. It should look and feel not like a hospital, but it should look more like a hotel. You're really seeing something different. It has a completely different feel from anything else that you've seen in the market. Our job as developers and as Forest Park Medical Center is to deliver a facility that's different than what the physicians are used to, what the patients are used to.
Oculoplastics includes a wide variety of surgical procedures that deal with the orbit, eyelids, tear ducts, and reconstruction of the eye. Dr. Christopher Dibakar is an oculoplastic and cosmetic surgeon here in the San Antonio area. Now let's meet the doctor.
I'm an oculoplastic surgeon who have a background in ophthalmology, and I've come to this specialty by a route that kind of has taken me through functional, meaning reconstructive type surgeries, and through more cosmetic surgery training over the years. So oculoplastic surgery is really a subspecialty of ophthalmology that concentrates on a balance of fixing things that are wrong with the eyelids and the adjacent areas of the face. And also, we do things that are to rejuvenate the eyelids and the face, such as cosmetic surgery. Bulk of my patients are really all ages. I see kids, I see children, I see newborns, and I see 100-year-old people.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way. To say that Forest Park is a state-of-the-art, leading-edge medical center is a huge understatement. From their cutting-edge technology to their highly skilled staff, Forest Park has made sure to bring only the best that San Antonio has to offer. Now up next, we're going to hear from the Director of Staff Development at Forest Park, San Antonio.
My position at Forest Park is the Director of Staff Development. I am in charge of the education program throughout the facility. The employees not only learn the first day that they are employed at Forest Park, but it's a continuous process. What I am excited about is the physician involvement in the education process here at Forest Park. The physicians are very engaged in making sure that staff involvement in the education process is continuous. They're invited to come into the operating room if they are a nurse in another area, so they have a better understanding on how to take care of that patient, especially controlling their pain while they are recovering at our facility. We are going for our AOA accreditation here at Forest Park, just as our other sister facilities are. And so there are lots of standards to raise the bar on patient safety and patient care. On a daily basis, we are striving to make sure we exceed those standards by making sure that our staff feel that they have the tools they need to succeed and take care of their patient. Learning every day is why we're here, and it makes Forest Park an exceptional place to work.
Did you know that Forest Park Medical Center Pharmacy is equipped with a fax carousel? This system helps better manage inventory by automatically tracking drug inventories in near real time. This system also supports efficient packaging and labeling of medications within the pharmacy.
Over the course of my life, starting when I was age 24, I've had 4 back surgeries, 2 on my low back and 2 in my neck. And I've had a total of 10 fusions in my spine. And after my last neck surgery, my neurosurgeon recommended that I look into having the spinal cord stimulator implant, at least the trial procedure, to see if that would help alleviate some of the low back pain that I was having. And so that's when I called Dr. Deleon's office to see about a consult.
Spinal cord stimulation is a relatively newer pain management technique. It involves implanting 2 electrodes in the epidural space. Those electrodes send signals to the spinal cord that mask or take place of the pain. So instead of feeling pain, the patient will feel a pleasant tingling sensation in their areas of pain. Usually the patient will undergo a trial, almost like a test drive, so that they're able to have temporary electrodes. They walk around for 3 or 5 days, do their normal activities. If they get good pain relief, then we would discuss implanting a permanent stimulator.
In January, I came and visited with Dr. Deleon, and he looked at my films and my history and said that I looked like the ideal candidate for certainly the trial, to see if that would be of benefit to me. And we scheduled that for early January. I had the trial implant and had it for about 5 or 6 days. It definitely was helpful, and then went through the paperwork to have the permanent implant, and then I had the permanent implant in March.
It was a day surgery where he was able to go home that same day. He had 2 small incisions, one over the midline of his back and one over the battery site, which is usually on the upper buttock. Did very well post-operatively, was able to get great coverage, and has just done really well afterwards.
My quality of life definitely improved. Dr. Deleon is terrific. He really listens. I think Dr. Deleon is one of those rare doctors who really has a lot of compassion for his patients. I think he's got to be one of the best in the San Antonio area.
Having a scheduled time for eating is a great way to keep your digestive system healthy. Try to sit down for breakfast, lunch, dinner, and snack at the same time each day.
One of the things that is important in nursing or any type of career is making sure that everyone is well educated on what the expectation is of the facility. When I became the CNO here at Forest Park, I wanted to be able to focus on clinical education to make sure that we were always providing safe care to our patients, and that all of our clinical staff were able to be educated on doing the same thing every single time to make sure that there was no room for any type of errors to occur. With that thought, we developed an educational program and hired a clinical educator that is master's degree prepared to be able to provide that type of education to our staff.
My role as clinical educator here at Forest Park is just to make sure All clinical staff are up to date on all evidence-based practices and current literature, and making sure that we provide our patients with top-notch care that is contingent on what research is backing these days. I teach anything from American Heart Association classes to ventilator classes to classes on hemodynamics to classes on basic needle sticks, blood draws, anything in the healthcare arena.
Clinical education is very important to both of my areas because as everybody knows, healthcare is always changing. We are updating our processes, we are finding new and better ways to take care of patients, and I want to ensure that my staff is doing everything they can to provide the best care they can to our patients. And so here at Forest Park, we have our clinical educator, Dan Cloud, who is very active with the staff, finding out what areas they feel like they need education on and finding out what is the newest research and articles that are out so that we can make sure that we're staying abreast of all of the newest research and practices.
Just seeing some of the nursing staff or clinical staff when you're teaching them something, when it finally clicks or they can take it back to the bedside with them in their interaction with the patients, that is the most rewarding for my job. I can talk and tell somebody how to do stuff all day long, but if it doesn't get taken back to the bedside, then it's not doing any good, especially in a healthcare setting.
Did you know that by visiting bestdocsnetwork.com, you can request an appointment with any of the doctors you've seen on today's show? Also on our website, you can check out more educational videos and browse through our doctor specialty gallery. Now up next, we have plastic surgeon and body contouring specialist, Dr. Peter Fisher.
My issue that I sought out surgery for is that I have a 200-pound weight loss, and that leaves your body very disfigured. If you need a mommy makeover or a tummy tuck or a breast lift, you could probably go locally and find a competent surgeon. I looked in Atlanta for surgeons, and there was none I was convinced in Atlanta that were true massive weight loss specialists. I found Dr. Fisher, and I did a consult with him. I had looked on his website, saw that he did have a specialty with the massive weight loss patients. But what really sealed the deal is when I talked to him. And when you talk to him, he gives you so much time and attention. He answered all my questions very thoroughly and thoughtfully, and with me in mind.
Melanie came in specifically because she felt like I could do a little bit more with her thighs and calves. She had had a gastric sleeve, had lost close to 200 pounds. At the initial consultation, I felt like we could get all the procedures that she wanted done in 2 operative sequences. And these included a lower body lift, which incorporates 5 different aspects, which is a tummy tuck, a Mons lift, a very strong lateral thigh lift, a buttock lift, and also the ability to do a buttock augmentation and hip augmentation.
Having the massive weight loss plastics afterwards is truly a way to complete your weight loss journey and feel good about yourself, to actually have a body you can feel good about. I wore my first bikini 6 weeks ago on a beach. I had never worn a bikini in my life, and I was so happy. And it's just a feeling you could not imagine, to be able to do that for your first time in your life. It's freedom.
The ideal candidate for this procedure is someone who's really lost a lot of weight and is really unhappy with their body. They have excess skin in areas that cause them problems. It's really unsightly, and they're just not happy with the way they look.
All I contributed to the process was the good sense to choose a doctor like Dr. Fisher.
I had 2 surgical procedures at Forest Park. I had bariatric surgery in September, and I've had my back surgery in April of this year. The staff at Forest Park was cordial respectful. The checking in process was done efficiently. There were no surprises. They had called me the evening before to remind me of what I needed to do to prepare myself. I sat in the waiting room a minimal amount of time before I was called back to begin the pre-op procedure. In both cases, I was in on one day and I was out the very next day and felt very comfortable during the process.
Just walking in, it did seem like a five-star hotel, but we were greeted at the desk by the concierge. They gave my husband a pager and explained to him what the paging system was like. They would send him a text how I was doing in surgery, where I was at, everywhere in the hospital. He was able to see at any screen where I was. And so it gave him a great sense of comfort knowing that, you know, he was being, even though it was electronic communication, that still somebody was letting him know as I moved through the progression of the surgery area, the recovery area, back to my room. He knew. It was incredible how the staff made sure that my family was taken care of while I was being taken care of.
I felt like I was in a 6-star hotel. The service was great. The people were wonderful. I really felt that I was treated as if they really cared about me and wanted to help me and get me to start recovering quickly.
And I felt really good being there. I didn't feel like I was in a sterile environment. It just felt homey. And that was nice because, you know, when you're not feeling good, it's good to be in a place that feels like home. And it was a place that felt like home. And my husband was able to stay overnight with me.
The nurses, the staff, everyone seemed really happy and ready to help you out. Where I've been to hospitals where it just wasn't like that. The rooms at Forest Park were extremely clean. The exterior, when you first see Forest Park, it does look like a 5-star hotel. Everything about it was a good experience.
All of our body has some fat, but when the liver has more than 6 to 10% of fat, this is what we call fatty liver, and this is too much. Fatty liver is usually discovered by accident, because patients normally don't have any symptoms. So when the doctor detects elevated liver enzymes, he may do a workup to find out why the patient has elevated liver enzymes. Fatty liver is more common on patients who have insulin resistance, patients who are overweight, or patients who have diabetes. It is also more common in patients who drink alcohol. It can also have some hereditary factors. If your doctor detects elevated liver enzymes, he may want to run some tests to make sure that you don't have uncontrolled diabetes, high triglycerides, or other diseases like hepatitis C that may also cause elevated liver enzymes. He may also run some tests like an ultrasound of the liver, and he may do an MRI elastography to find out if your liver has the common fatty liver called NFALD, or if it has the more severe cause of elevated liver enzymes called NASH. In this case, what happens is the liver enzymes are going to be high, but patients tend to have severe inflammation of the liver that can progress to liver cirrhosis and eventually to liver cancer. So it is very important to differentiate between the two causes. So what things can you do if you have fatty liver? One of the things is to exercise, to lose weight, and by all means, avoid alcohol. If you have high triglycerides or high cholesterol, make sure that you control those and make sure to control your diabetes also. If the condition progresses, make sure that you see a liver specialist, as you may be a candidate for research or for a liver transplant.
You notice something about Forest Park Medical Center the moment you walk through the front door. Gone are the smells, the sights, and the sounds that are typically associated with most hospitals. And in their place is something decidedly different. You see, Forest Park Medical Center was designed to be comfortable, inviting, even calming. Fact is, many of our patients don't want to leave. Come experience for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
The mission of Red Zero is to end prostate cancer. They will save lives and stop pain and suffering by advancing research, encouraging action, and providing education and support to men and their families. Now up next, we're going to take a look at how Forest Park teamed up with San Antonio's Zero Prostate Cancer Run.
been amazing. And to all the folks here in San Antonio that have come out.
And in particular, we've had great support from Forest Park. They've been a wonderful partner in this event. Just can't say enough good things about them. If you find prostate cancer early, you're not going to die from prostate cancer. There's a good chance you're going to do really, really well.
Brian has a question for Dr. Jesus Rodriguez. Who should get the shingles vaccine?
Well, the current recommendation is that every adult starting at the age of 60 get the shingles vaccine. It's a one-time dose, does not have to be administered again. But everybody that's had chickenpox, or even if they can't recall having had chickenpox, should consider getting the vaccine. Patients that have had shingles in the past can still get the vaccine to prevent possible future occurrences. Shingles is caused by the varicella virus, which is the same virus that causes chickenpox. Typically what happens is that as we're recovering from the chickenpox, that virus becomes dormant and then can reactivate years later. When it reactivates, it's associated with a very painful rash that can have burning, itching, and can be quite debilitating.
And that'll wrap up another episode of Best Docs Network featuring Forest Park Medical Center, your destination to better health. For more information on this hospital or their physician partners, please visit our website, bestdocsnetwork.com. We love hearing from our viewers, so if you have any questions or comments, please feel free to email us at info@bestdocsnetwork.com. I'm Carla Macias, and we'll see you next week.